Do you have atrial fibrillation? Centra Heart is excited to announce a new treatment study for patients diagnosed with this common heart disorder. If you have atrial fibrillation, also referred to as AFib, you may benefit from participating in a medical research study for patients diagnosed with persistent or long-standing persistent AFib. The purpose of this study is to determine if the combination of two non-surgical treatments, pulmonary vein isolation, PVI, and closure of the left atrial appendage utilizing the lariat procedure may treat atrial fibrillation more effectively than PVI alone. The study is called the aMAZE trial. AFib is an irregular heartbeat which results from a malfunction of the heart's electrical system. The left atrial appendage is a small sac the size of your thumb that hangs off the left atrium of your heart. It is a source of electrical activity and may contribute to the abnormal rhythm of the heart. Pulmonary vein isolation involves delivering energy to the tissue in the heart to create a scar that helps stop erratic electrical signals. This procedure typically does not create scar tissue at the left atrial appendage, which may continue contributing to your irregular heart rhythm. The lariat procedure delivers a suture loop over the left atrial appendage and is tightened to close the left atrial appendage. After it is closed, a scar forms around the closure location, potentially eliminating a recognized source of AFib. The aMAZE trial is being conducted to determine whether the lariat procedure, when combined with pulmonary vein isolation, can reduce the recurrence of persistent and/or long-standing persistent AFib versus pulmonary vein isolation alone. The study will look at two groups, one that receives the lariat with a PVI procedure and another that receives the PVI procedure alone. You may be eligible if you have AFib, you are already scheduled for pulmonary vein isolation, and the drugs you are taking to control your AFib may not be working. In summary, you may be eligible if you have persistent or long-standing persistent AFib. You are already scheduled for pulmonary vein isolation, and the drugs you are taking to control your AFib may not be working. If you are interested in learning more about this study, discuss with your physician and/or go to www.amazetrial.com to see more information.